Good morning, this is Dr. Stewart from Timonian Foot and Ankle Center. I want to do a follow-up video. We're about a year out. Good morning, Beth. This is Beth. How are you?
Good, how are you?
So Beth came to me about a year and a half ago. She was dealing with a lot of pain in her foot and ankle, and she had a lot of instability to her ankle. Beth, kind of tell us what happened to you. What was your injury?
About 5 or 6 years ago, I rolled my ankle while I was running one day, and then it was just a chronic issue after that. So every time after that, whenever I would go hiking or walking my dog, or I'd step wrong off a curb, I would roll it, and it went on for several years with swelling and pain and instability. So eventually I decided it was time to get it fixed.
Right, so Beth came to see us and we diagnosed her with a bunch of problems. She had some impingement of her nerve. She had a tarsal tunnel impingement. She had on the outside of her ankle a lot of instability. Her ankle was rocking and rolling. And we treated her extensively with conservative care. We put her in a combination of compression socks, bracing, resting, doing some exercises, range of motion. You just were not getting better, unfortunately.
No, we also did the laser, I think, if I remember correctly.
We did do laser. Now, laser is something that we did for her, and laser is generally very effective as an adjunctive tool. We do tell all of our patients that not all cases of laser get better, and Beth was well aware of that. You saw some improvement with laser for sure.
Yeah, the laser helped a lot with my swelling and a little bit with pain, but I was still having the chronic rolling.
Right, so
stuff.
Lasers, and that's a good point. I appreciate you bringing that up. She had a reduction of her pain and swelling with laser, but it will not correct the instability. She had a ligament tear, and lasers will not correct the ligament tear. We did pursue the laser because she was trying to avoid surgery, and she was very well aware that the ligament tear would not repair. And we definitively have had cases with laser where despite having instability, the pain reduces enough we're able to avoid surgery. Unfortunately, that was not the case here. However, we did surgery. It's been a year. How are we doing?
I'm doing great. It's, occasionally when it rains, it gets swollen. If I do too much activity, it gets swollen. But it doesn't hurt like it did before. It doesn't roll like it did before. I've been doing a lot of hiking. We recently went on a family vacation, did a lot of stuff, zip lining, hiking, things before that I know I would have possibly injured myself doing. So I feel like I have a lot of my, control of it back.
Excellent. So she's restored her quality of life. She made an important point. Whenever you have an ankle injury, I tell my patients before surgery, you may always have some swelling. You may always have some level of chronic pain. But at the end of the day, her burning is gone. She had a lot of burning. She had a lot of instability. We can see this ankle is very stable when we come over here. It doesn't roll. Whereas before, when I did this, before the surgery, if I rolled this, her entire foot would roll underneath. So this is Dr. Stewart from Timonian Foot and Ankle Center. This is an example of a patient who had tarsal tunnel impingement. So she actually had some tendonitis. She had a lateral ankle sprain. We really tried conservative care. Unfortunately, it did not work out, but she went down a surgical pathway and she did very well. If you'd like to learn more about foot and ankle injuries, visit our website at www.timonianfootandankle.com. Thanks.